My name is Ellen Fix, and I practice at the Fountain Hills Center in Grand Rapids, Michigan. About 14 years ago, I was introduced to neurotherapy. I'm a parent, and one of my children has a severe mood disorder, and I was frustrated as a parent, even though I'm a therapist, of the lack of treatment that was available besides medication management. I mean, she was in therapy and I was in whatever. And through a colleague of mine, she said, well, have you heard about this neurotherapy? There were 2 people in Grand Rapids that were practicing. She was one of them, and so she couldn't see my daughter. So we went to the other person. In 9 months, I had my intelligent, happy daughter back again. And she since went on, graduated from high school, honors from college, and is a professional in New York City now. So as a parent, I went, man, this stuff is amazing. It's just, wow, I didn't even understand it, but it worked. 6 years ago, I joined the Fountain Hills Center in private practice and as an addiction therapist. And my colleague, who had told me about neurotherapy, was practicing there, and they wanted another neurotherapist, and they said, hey, you want to learn how to do this? I said, sure, why not? And have been training and practicing since. First of all, neurotherapy is brain regulation with the use of computer software. Some people get that, some people don't. What I use is I have a magic eye book, and it's one of those books that you look at and the picture comes up to a 3D image. This is not something you can do consciously. It just happens. And what I tell clients is that's what happens with neurotherapy. You're going to look at the screen. However, while you're looking at the screen and say you're playing Pac-Man and making this little guy move with your eyes, I'm able to see how your brain is firing. I'm able to challenge your brain without frustrating it. And the cool thing about neurotherapy is that it's measurable. We can see when you started what your brain activity looks like and what it looks like at the end. It's not invasive, you're not taking medications. You might be sleepy afterwards, but you know, if that's the only side effect, that's not so bad. And it's non-threatening, so with teenagers who do not want to come and talk to Stinky Miss Ellen after school, they can play a video game. So it's friendly, it's client friendly. As an addiction therapist, I work with a specific, well, I work with a big population, but I do work with many healthcare professionals, attorneys, some judges, and these are people who, if they relapse a second or third time, they can lose their license, so they're very motivated to stay sober. So when they come into my office and they've been through treatment, there's this almost desperation of, this is my last chance. Please help me, this is my last chance. Well, I use cognitive behavioral therapy, which is if you change the way you think, you can change your behavior. So I'll reframe that and say, well, don't give yourself your last chance. Give yourself a fair chance to be successful. So I train with anxiety. I train with depression, some body calming. And what this does for the client is suddenly they can, it's like their ego strength gets healthier. So instead of going to a family party and someone gives them a pot shot about their drinking and them jumping into shame, they're able to change that and say, well, I'm glad you asked that. I'm doing something different. I'm going to meetings. I'm trying this neurotherapy. I'm doing this. And the reaction they get from the person giving them the shot is something is different. And that aha moment for that client is huge, that their recovery will happen for them. It can happen for them. And that's big. And of course, it's not quite that simple, but it does work. And I took kind of the long way around to figuring this out, but dual diagnosis is very common in people with addiction, and alcoholism and depression are closely linked, so it works. I've been to 5 conferences. I love coming to the conferences because you see the same people. You talk to everyone almost, you know, several times a week because we have a listserv. Hey, I tried this and this is what happened, or I have a client and I've tried this and nothing's working and it's worked for, how would you do that? So there's this wonderful mix of what's happening with other practitioners, so that's a shared piece. All my equipment is through the same company, so I bring it to all my to the conferences, so it can be upgraded. I can get new games. If something needs to be fixed, it's there. And I know who's working on my stuff. If I have a problem, I call on the phone, and I know who's working on my stuff. My partner, who's in practice with me, is also an affiliate. And she's the one who said, you know, you need to continue to do this. And it's just a great collaborative effort of a lot of cool people. I'm a recovering person, so the best surprise in my life is no surprise. So I like little things in life, and it's when I had one little boy that had a lot of integration issues, and then he had handwritten me this beautiful Valentine card. I mean, it was great. This kid, you know, he wouldn't do things like that. The mom that comes in, and it's hard for a parent to say, you know, I love my daughter, but I can't stand living with her and her choices. It's chaos at home. 6, 7, 8 weeks later, that parent's saying, oh, I not only love my daughter, I forgot how funny she could be. And they, you know, there's this healing process that goes on because the family is a unit. And it seems like the neurotherapy helps with everybody. The parent says, oh, we can get out of the house so much easier now. So those little things, and as a parent, believe me, I get that. Or a kid brings his report card in. He says, here, look, Miss Ellen, I got all green lights this week. I didn't get any red lights. And, you know, those are the little things that mean the most to me. Because that's the stuff, little things keep me sane, little things make me crazy, and I think that's the bigger picture. So I just kind of enjoy those little moments. The other reason I like neurotherapy is because as a cognitive behavioral therapist, neurotherapy does help with the brain. Cognitive behavioral therapy is for the mind. It helps a client understand what they're doing. Neurotherapy is exercise for the brain. It's the 1-2 punch. So they understand it, but they can see it working too. So I won't do one without the other. And it works for depression. It works for attention deficit. It works for anxiety. It works for obsessive compulsive disorders. I've been able to help clients that have eating disorders, and that's pretty difficult to treat. It just has a lot of applications to it. But it's non-invasive, as I say. It's not threatening. No side effects, no prescriptions. You don't have to look at the therapist and kind of what your feelings. You know, it's just good.